Hello, happy Monday. Hope you're doing well. I just wanted to pop in here for Better Speech and Hearing Month this May and give you a little quick tip about some speech therapy related items. Last week I started talking about autism. It is a big and very important component in our field. A lot of times we work with children on the autism spectrum, and the rates, unfortunately, are showing continued increases in the diagnosis. So I think it's important for everyone to be aware of some of the red flags to look out for. So if you are a parent, a caregiver, even a professional that works with children, I just wanted to give a little bit of information on some red flags that you can look out for if you suspect that a child has autism. And this information is being taken from a great resource called Autism Speaks. So, sometimes children will show signs of future problems within the first few months of their life. Other times the symptoms take a little bit longer to surface, mostly around 2 years of age or maybe a little bit later. And some children with autism appear to develop normally, and then around 18 to 24 months of age, they stop gaining skills, or sometimes they'll even regress and start losing some of the skills that they previously had. We hear that a lot of times from some families that we work with who have children on the spectrum. So just a quick rundown of a list of some of the red flags that may suggest that a child has autism that you can look out for. And if you think that a child, your child, or any child that you work with may have some of these symptoms, definitely seek out help from a medical professional, either a pediatrician, or every state has a what we call a birth to 3 or early intervention state-funded program that you can also look for depending on where you live. So, possible signs of autism for babies and toddlers. By 6 months, if they're not socially smiling or not having any joyful expressions towards people, that is a red flag. If they're by 6 months, there's limited to no eye contact with others. By 9 months, if there's no sharing of vocal sounds, smiles, or nonverbal communication. So if they're not babbling, cooing, making noises directed at another person, or imitating or looking and imitating different facial expressions. By 12 months, if they're not babbling, that could be a red flag for autism. Again, by 12 months, if there's no use of gestures to communicate, such as pointing or waving or reaching for items. Also by 12 months, if there's no response to when their name is called. For that one, definitely rule out any hearing loss, so talk to your pediatrician about that. But if there are no concerns with hearing, then that could be also a red flag for autism. By 16 months, if they've said no words. By 24 months, if they have no meaningful two-word phrases. So typically, children by 2 months of age are putting two words together and forming short phrases like mommy go or daddy up. And then another red flag is any loss of any previously acquired speech. So if they had seemed to be developing their speech and language skills normally, and then they regress or don't gain any new skills, that could be a red flag for autism. And then at any age, possible signs for autism could be that they avoid eye contact or prefer to be alone. They struggle or have a really hard time understanding other people's feelings. They continue to remain nonverbal or have delayed language development. Maybe they repeat words and phrases over and over again, which we call echolalia. And I'll talk a little bit more about that in a separate video about how that is a skill that children with autism use to gain language. Perhaps a red flag could be they get upset by really small changes in their routine or surroundings. They might insist that you go home the same route every day and get really upset if there's a change in that or a change in their schedule. Another red flag could be they have highly restricted interests. So maybe they only want to talk about one or two things and they'll talk about it over and over again and have a hard time talking about different topics. Another red flag for autism could be that they perform repetitive behaviors such as flapping their hands or any parts of their body, rocking or spinning. And then another red flag could be they have unusual and intense reactions to different sensory sensations. So sounds, smells, tastes, textures, lights, colors. Perhaps they need to have a very specific diet or routine for their foods, and any other flavor or smell or color sets off a big reaction. That could also be a red flag. So again, if any of those things sound like, or a combination of them sound like a child you know, definitely I would recommend seeking out help from a medical professional to get a better assessment to see if it is autism. And like I've been talking about, early intervention services are definitely key to help the child to live out their maximum potential and see growth in therapy. So I will see you guys back tomorrow and hope you have a great night. Bye-bye.